I'm Professor Marie PERON from Toulouse, France, hepatologist, and I'll be talking about hepatitis E today. What's new? What are the hot topics on hepatitis E? So the first topic is the incidence. The incidence of hepatitis E is rising in a lot of countries, particularly in France. Second important topic is the subtypes. We have data now that are showing us that the subtype may be important for the severity of acute hepatitis E, and subtype 3F is probably responsible for more severe hepatitis E with more hospitalizations. Hepatitis E is also responsible for neurological symptoms. In almost up to 20% of cases of infection with hepatitis E, you have some type of neurological symptoms. And the two main ones are neuralgic amyotrophy, also called Parsonage-Turner syndrome, and Guillain-Barré syndrome. In those two neurological diseases, you can have sequelae, and they're related to hepatitis E. Diagnosis of hepatitis E in France and in Europe is based on serology in immunocompetent patients, and if you have immunodepressed patients, then you need to do a PCR assay and directly look for the RNA of HEV, either in the blood or in the stools. Treatment of chronic hepatitis E is basically monotherapy, ribavirin regimen. 3 months of ribavirin cures almost 80% of patients with chronic hepatitis E. If that doesn't work, then you need to do a longer treatment of 6 months of ribavirin. In about 10 to 20% of patients, this will not be enough, and then you have to treat them with another medication, which can be, in some cases, interferon alpha. This should be reserved to patients that are either immunosuppressed because of AIDS or hematological malignancies, and sometimes you can treat them when they have a liver graft. The last part of my talk will be treatment of acute hepatitis E, and treatment of acute hepatitis E is sometimes indicated in severe cases of hepatitis E, or if you have hepatitis E associated with a neurological complication, and it relies on ribavirin and monotherapy, a la carte treatment, which means that you can stop the treatment when RNA disappears in the blood and in the stools. Je crois que c'est tout. So, in conclusion, hepatitis E is a very frequent infection in Europe, and it should be looked for in all patients with elevated transaminases, neurological symptoms, or decompensated cirrhosis.